All right, good morning, everybody. I'd like to welcome you all to day 3 of the Canadian Autism Leadership Summit, our 10th anniversary and our last day. My name is Matty Dever, and I'm one of the vice co-chairs of the Alliance, and it's my pleasure to start this day with you today and allow Sue, one of our other board members, to introduce herself.
And hi, everybody. Not on? Oh, it's on now. Hi, everybody. I'm Sue Koch, and I'm one of the board members of the Autism Alliance, and also in my day job, I'm the CEO for Carey's Place Autism Services in Ontario.
And my day job is I'm an autistic adult, and I'm a parent of 4 other children who are all autistic. So we've hit the neurodivergent jackpot, is what I usually say. Bear with me. I'm having cataract surgery next Tuesday, so my sight is limited. So I'm going to hopefully not stumble over any words here. This is an opportunity to remember our guiding principles for the summit. We want to embrace the opportunity to take space and to make space. We speak from our experience. What is said here stays here, and what is learned is shared widely. Have fun, have a laugh or two, assume good intent, consent to learn in public, and most importantly, take care of yourself.
We're dedicated to building an inclusive space here where each participant feels like they're not only welcome but empowered to actively engage. If you find yourself feeling uncomfortable at any point in the summit or you need assistance with anything, please don't hesitate to reach out, and our wonderful logistics teams will help. And if you ever feel overwhelmed or need a moment to recharge, please feel free to make use of our sensory-friendly space outside, our Zen Den, which I think most of you have seen by this time. It's located in the Laurier Room. So thank you for the Autism Home Base for creating this space.
We encourage participants to engage in silent clapping or waving throughout the duration of the summit. Opting for silent gestures instead of traditional applause will ensure a more inclusive environment for those with sensory sensitivities who may find loud noises overwhelming. At any point during the summit, you also have the opportunity to listen in without actively participating in the discussions or networking sessions. And yesterday we had an amazing day, and I want to just touch on 2 things that I experienced that I want to take with us today. Our wonderful panelist, Cindy, said a really profound statement. We tend to talk the talk and talk big, but we don't always walk the walk, and we walk small. And I want us to think through that as we listen today and as we move on from here. How can we make the big talk become the bigger walk? And the other thing about yesterday that really was amazing, around the table that I was facilitating, there was so much talk about not just what is wrong, but the things that are working and how we can make those things better. And I think when we are looking at the National Autism Strategy, when it eventually comes out, we all have a path to take the things that are working across the country and find ways of making them work in our local areas. Thank you.
So I'd like to take this opportunity to, again, we can't thank them enough. So I'm going to take this opportunity to acknowledge our top supporters. CNE Foundation, of course, special thanks to them for the great help that they have made this possible and making our live stream option possible for our attendees outside this convention. And we'd also like to, of course, thank our Joyce family, the Hamilton Health Science Center Foundation, and the Israeli Foundation for their generous contributions that you have all been aware of at this summit. This year, as you know, we've had a record number of companies that have helped with the summit. We had 24 in total, and we were really blown away by all that support this year, and it's really made this possible. So we thank all of our supporters. Maddie?
Yes, at this point, I would like to introduce Annabette Achneepineskum, who is the Nishnawbe Muskego from Martin Falls First Nation. As Deputy Grand Chief for Nishnawbe Aski Nation and as a social justice advocate for many years, she has strived and committed to raising awareness of issues and challenges experienced by First Nation people, families, women, and children. Annabette is a person of action and a strong voice for transformative social change. Her life's work and contributions are driven by a passion to help the most marginalized people, especially the people from the Nishnawbe Aski Nation territory. In whatever she does, she advocates for equitable access to justice and services and for improving the quality of life, community wellness, and safety for all NAN citizens. She currently resides in Thunder Bay and credits her children, grandchildren, and her first great-granddaughter as the inspiration for her lifelong work, service, and advocacy.
Wache, Memengasat Sokan Squadness in the castle. Biggest in with them. Margadaski Nandonji. My name is Annabette Achneepineskum, and I serve as a Deputy Grand Chief for Nishnawbe Aski Nation. I'm much honored and grateful to be with you all today, and much respect and honor to each and every one of you that continue to live with the lived experience, serve and advocate and lobby for citizens that live with autism. I'm very honored to come from our homelands of Nishnawbe Aski Nation, and grateful that I have an opportunity to come and sit with you, learn from you, and also share. So for the next 10 minutes, we will have this opportunity to share about our citizens and our homelands. We have displayed, we have a map here that shows Nishnawbe Aski Nation territory. Our communities are Treaty 9 and Treaty 5, and as you can see, we cover a vast territory, and we have many of our communities that are only accessible by air, and then during the winter time, if we're fortunate enough, then we can utilize ice roads, winter roads. I also want to acknowledge my team that I'm here with. I sit with them over there, and they're the ones that I refer to as the champions, and because they're the ones that are working for our people to raise awareness and also to bring the resources. At this time, our people that are living with autism have no resources or very little. The Nishnawbe Aski Nation has 49 First Nations, and as you can see on the screen, Nishnawbe Aski communities cover a substantial portion of northwestern and northeastern Ontario. And as I mentioned, 33 of those First Nations are remote. And ongoing challenges, including housing, education, mental health, access to clean drinking water, and the excessive costs of living, and limited access to medical, professional, and assessments. Our furthest community is Fort Severn. So if one was to travel to Thunder Bay, for example, because Thunder Bay is a medical hub for northwestern Ontario. So a person that is wanting to access a professional medical must, it's about an average cost of $1,700 for a person to travel there and back. And so that is in itself is a very significant challenge. In the last few days that we've been here, we have heard many conversations and a lot of reference to Bill S-203, which provides a mandate on the development of a federal framework on autism spectrum in consultations with relevant stakeholders, including First Nation communities. We heard on day one of a summary of 8 national Indigenous organizations which were consulted, yet we, Nishnawbe Aski Nation, have not been engaged or consulted. So that is why we are proposing and that we, be the voice for our people, because we have been given that consent by our people to be their voice. If they are not, for individuals that are living with autism, we have a lot, very frequent conversations with them and engagement processes. So we carry their voices with us. And also, we are honored that they entrust us to do so. Nishnawbe Aski is unaware of further consultations in their territory, despite previous engagement efforts. Our team have existed for many years now, and we have made a lot of effort to have those engagement processes and consultations. And so at times it has failed, not to our efforts, but to those involved, whether it's a provincial or federal representatives or other tables. The Autism Alliance of Canada suggests an Indigenous-specific parallel strategy in the National Autism Strategy. We do support that as long as we are part of that table. UNDRIP emphasizes meaningful engagement with Indigenous communities, including obtaining free, prior, and informed consent. It is especially important for the Nishnawbe Aski Nation on-reserve community voices be heard, as the needs are vastly different from urban living. Nishnawbe Aski Nation community members face intensified challenges in accessing autism programs and services due to remoteness, health inequities, and socio-economic disparities. Inflated cost of airfare to and from our First Nation communities are often $1,000 one way. This impacts the ability to go out of the community for medical appointments, follow-up medical care, and access to specialists or assessments. Tailoring support strategies is crucial to addressing our unique needs, such as the possibility of a language barrier, which may not be in translation, we may not be translated over. Virtual options cannot be the priority or solutions. Initially, in-person is preferred. The required specialists are not coming into the communities to do their assessments. And I think many of you can relate to this, that, that any services that are provided, especially from professionals, as a doctor who at times is the one that would provide the diagnosis, it should be an in-person consultation. And unfortunately, that is very rare for us to access that. And it is quite a challenge for like a young person to go to an urban center to get that assessment. There seems to be, a lot of, I would say, lack of education in terms of some of the medical professionals that come into our communities, because we do have doctors that come into our communities. Some of them come every 3 months, and within a 1 week time frame that they are there, they are, scheduled to see a lot of people, and a lot of times our children or adults that are wanting to get an assessment or diagnosis, they're the ones that are not a priority. There's others that have physical health ailments that would become a priority. So it's those are one of the realities. It is crucial to address the lack of engagement in consultation with First Nations in the development of the federal framework of the autism spectrum. Meaningful involvement of Nishnawbe Aski Nation and other Indigenous groups is essential to create effective and inclusive policies and programs. Nishnawbe Aski Nation wants to be your partner. The Access Ontario Autism Program does not have members listed in that data. We are not able to get on that list due to the lack of assessments and invitation to join and access it. One of the issues of our membership cannot access or get to the service organizations due to remoteness and travel issues. Unfortunately, many people move away from their home communities to urban centers in hopes to access services quicker, which is not always successful. A few days ago, I was sharing with our team members that, I know of some families who've had to place their child in the child welfare system if their child was special needs, whether physical or mental, and because that child couldn't have the services in their community, therefore had to be placed into a child welfare agency so that they can access services and resources out of their community where the parent was unable to get those. And that in itself is such a discriminatory when it comes to our First Nation children. A true disparity for some community members is the decision to place children or keep children in child welfare system. Virtual medical consultations are not options and often recommended, however, do not satisfy the service needs as technology can take away from the human element and interaction and personal care that is needed for families when addressing neurodiversities, let alone the Wi-Fi service within our communities may not always be adequate. In our Nan First Nation communities, we do not have accurate stats on the actual number of children and adults diagnosed with autism. Long-term funding is required to assist in gathering this information and ensuring all children with identified neurodiversities get assessed as needed. The Nishnawbe Aski Nation has been making gains in building relationships with community partners and is making strides with Westway, the Autism Alliance, Firefly, and George Jeffrey Children's Center, to name a few. We are very hopeful and resilient people. In conclusion, it is our hope and our request to work together to ensure all children and families needing assistance and resources get that help in a timely manner. Wacha Ichimingwech.
Thank you, Chief.
Our next speaker is Philip Riscala. He is the Chief Executive Officer and the Deputy Head of the Accessibility Standards Canada. Since 2019, he has led this departmental corporation in setting initial policy, receiving accreditation, and establishing strong governance practices. With his team, he spearheads the development of accessibility standards to deliver on the organization's mandate to help achieve a barrier-free Canada by 2040. Between 2014 and 2019, Mr. Riscala led teams at the National Research Council of Canada as Program Director, and prior to that, as Director for the Building Regulations Resource Unit. Known for his ability to manage programs involving multidisciplinary teams effectively and efficiently, Mr. Riscala has led strategic project proposals, secured financial commitments, and built teams to execute these projects. Between 2010 and 2018, Mr. Riscala was a key player in the Regulatory Reconciliation and Cooperative Table as the federal representative with the Federal Provincial Territorial Working Group. While in this role, he worked to align national codes in the country and introduce codes accessible, free of charge. He also contributed to the development of the ongoing RCT agreement, which will be key in harmonizing accessibility requirements across Canada. A registered professional engineer in the province of Ontario, he holds a Bachelor of Mechanical Engineering and a Bachelor of Science. Please welcome Philip Riscala.
I want to walk. I don't like standing on the podium. So welcome, everyone. Thank you very much. And I apologize for the long, boring bio. So basically what I am is somebody that's going to make your life accessible. This is what I do, and this is my passion. So my name is Philip Riscala. I am the CEO for Accessibility Standards Canada. And for anybody who doesn't know who Accessibility Standards Canada is, I'm going to tell you very, very quickly. I'm going to give you a 101 version of that. The Accessible Canada Act identifies three entities. You have your commissioner, Michael Gauthier, who's here, in charge of compliance. You have Stephanie Cadieux, who is the accessibility officer, Chief Accessibility Officer in the country. And then you have our department, which is Accessibility Standards Canada. And the role that we play is that we develop standards. Don't fall asleep, but we develop standards. And the purpose for these standards is that we can take these standards and recommend them to our minister, or I can recommend them with the recommendation of our board of directors to our minister and say, we would like you to put these into legislation. That's a lot of power. So what do we do that's different than most other organizations? We develop standards, and I'm sorry, I walk around because I don't like to stand at a podium, so you keep with me and I won't go too fast. So what do we do that's different? We develop standards. Everybody's heard of building codes. Everybody's heard of standards. What's different with us is we still develop on the principle of minimum acceptable. So standards are usually, when you develop building codes, they're based on minimum acceptable. Where we're different is that we are inclusive. So instead of developing for the 75th percentile of the population and leaving the outliers out of the decision making, whether it's a standard for buildings, whether it's a standard for employment, for procurement, for transportation, for communication, doesn't matter. Whatever standard that we're developing in, we're not just developing it based on that 75th percentile. We are very, very inclusive in the sense that we want to get the voices of all the population when we're developing our standards. So that makes us very unique in the sense that we're going to, and I'm never going to say we're going to 100%, but I'd like to say we're at about 95+%, because there's always room for improvement, and I never want to come here and lie to you and say we're capturing everybody's needs, because we want to get there eventually. But when we're designing for 95% of the people, if you look at it as a circle, if you're designing for 95%, you're designing for everybody, even the 75%. So we are very inclusive, and so how do we do this so that it's actually different than most other organizations? Well, first of all, we develop standards in a way that includes the community of persons with disabilities. It includes the autistics. It includes persons with every kind of disability on our committees. And that is key. So we do not actually start a committee, and these are the committees that actually make the decisions of what goes into our standards that will eventually become policies, which will eventually change your lives for the better. So right at the grassroots, we say, okay, we don't start the committee until we have balance from across the country. We don't start the committee until we have balanced gender. We don't start the committee until we have at least, we'd like to say 30% of our members are persons with disabilities, but in fact, we're about 58% of our members are persons with disabilities. We haven't gone below that number yet. We're actually at 75 in some areas. So this is not tokenized members that are on our committees. These are experts with lived experience that are sitting on our committees making decisions that are going to change their lives. So that's the first thing we do that's very different. So we create standards with the involvement of all the groups. Then we go out and consult with groups. So we make sure that when we're going out and we've created a standard, can I look to you and you tell me when I have like 2 minutes left, if you don't mind? I have no idea when I started, that's why. So what we do is when we've developed our standards, we go back out to the communities and we ask them, have you done this right? Give us your feedback, give us your comments. You have 90 days to tell us everything that we've done right, everything we haven't done right, and we take this back and we reconsider it. And this is an opportunity for this group to actually sit there and say, okay, we want to collectively look at what you're proposing for employment, what you're proposing for buildings, what you're proposing for housing, whatever the standard that we've developed, we want you to look at that and tell us, did we capture the needs of your group? And if we haven't, tell us that so that we can make those changes. And we are very eager to hear the negatives. We don't want you just to say, great job, go on. We want to say, hey, you missed this segment, or maybe you should have looked at this a little differently. And then we take this information, we include it into our standards, and hopefully we've developed some of the best standards, not in the country, but in the world. We are the only organization that does what we do. We're the only organization that has the mandate that we have, and we're the only organization that can actually push this into policy anywhere. This is a lot of power. This could really make a big difference, but it's only going to work if the community, if everybody actually gets involved in the input. If everybody gets involved and tells us we're doing it right or we're not doing it right. I'll mention a couple more little things that we do. We have a research component to our organization, the grants and contribution component. And this is really key. The government has given us $8.5 million a year that we can give out to organizations such as any of the organizations represented here, so they can do research. We'll come out and say, look, we're developing a standard in employment, or we want some more information on procurement, or we want more information on transportation, any area. And we say, can you propose something to us for a project? The project can be from $100,000 a year to $350,000 a year over 3 years. So it could be up to $1 million roughly. And if you have a project, Working with the community, this is the key part. You cannot just propose a project if you're an academic or if you're an engineering firm. You have to work with the community. You have to work with the members that are here. If you want to propose a project, you send it to us once a year, every end of May. We put calls out for proposals. You submit that proposal. We look at it, and if we're happy with it, you may be selected for a grant to do that work. That research then helps us to inform our standards. It helps us to actually inform policy. It helps the community to actually make changes or remove barriers that may be impacting them as well. And it's very, very key that you look at this. One of the conditions we put in this is that we no longer want to take advantage of any community. If you're being consulted throughout a project, you have to be paid to be consulted throughout that project. That is key. You never submit a proposal and say, we're going to survey the community, we're going to survey the autistic community, we're going to survey this group or that group, and we're going to get information and feed in. Again, we want to see the line item that says we're paying this group to get that valuable information from them. And it's the same thing with our technical committees. We pay the members on our technical committees. Not all members. We pay the members where their employers will not pay them to sit on our committees. So we don't want that to be a deterrent, that you can't come to our committee because you work for a not-for-profit or you work for an organization that's too small to afford to have you sit on our committees and do work. We will offset that with a salary. It's about $60,000 a year, prorated based on what you're doing on the work, but it's enough to get the membership on our committees. So we really tried to think about all the little elements that we need to do to make sure that we're getting the right members, we're getting the input, and we value that input. And we also have a very open and inclusive office. This is something that I'm very, very proud of. When I took over as CEO of this department, I was very fortunate. I walked into an office and I had one staff member. I was appointed to this position and they said, Philip, build it the way you want to build it. And that's exactly what we did. We built the most accessible office in the country, and we've actually had other countries come and visit our office. It is the most accessible office that I know of in several countries that I visited and that have come to our office. So we built it very accessible. We have a hiring rate of over 35% of our members, of our staff, as persons with disabilities, and we provide all the accommodations they need. So we figured if we did it from the foundation up and we know what we need to do, we can start developing products that actually meet their needs. And so that's what kind of makes us a little different. And that's why I'm really proud to be working for this organization. I'm also very proud that we have our new chairperson, Paul Walsh, sitting in the back there. So I look forward to working for the next 4 years with our new chairperson. And we have some other board directors here as well, which is also another unique element of our organization. I do not report to government. I don't report to government. Yes, I'm a civil servant. I'm appointed through a parliamentary process, but I don't report to government. I report to your peers, a board of directors made up of persons with disabilities. So they keep us on track. They make sure we're doing things the right way. They make sure that we're providing the value that you need. And then they will help us to kind of push governments to push these changes through legislation down the road. I'll stop here because I know I'm over my time, and I do apologize.
I'm wondering, thank you, Philip. Are we allowed questions? Is that, I'm looking for John. Yeah?
I say yes.
No at this point? I'm looking at our timers. They're saying no. Would you like? now that I offered. Oh, Philip's going to be here all morning, so that will give you a chance to talk to him. Thank you very much, Philip.